Welcome to the PAWSCAST, and now here are our hosts.
Hi everybody, today we're joined by Susan Mandell, Clinical Director of Frostburg State University's Counseling and Psychological Services. I'm Dr. Amanda Vanderveer.
And I'm Tajay Bolton, and today we're going to be talking about depression.
So everyone feels sad sometimes. I know there's been days where I'm like, ugh, life. And we all struggle with loss and grief and like all of the stuff that can really contribute to depression. So how do you know when it crosses over that line, when you need to help seek treatment and find help for that?
Well, absolutely, you are correct. Sadness is a normal and healthy emotion to experience. We typically feel sadness in response to an event in our life, and depending on how significant that event was, it may last for a prolonged period of time. So, for example, if you experience the death of a loved one, there may be a prolonged period of grief and sadness related to that event. So when we're considering whether or not someone has depression, we begin by thinking about how their mood is impacting their thoughts and behaviors. Depression is characterized by negative thoughts about yourself, the world, and the future, and it impacts our ability to function as we are normally able to. A person struggling with depression may have difficulty going to school or work, may lose interest in activities that they typically enjoy. You may have changes in your sleep patterns or changes in your appetite. You may have difficulty concentrating, and you may even begin to have thoughts of ending your life. As for when to seek treatment, certainly the sooner the better. If you're noticing that you don't feel like yourself or are experiencing any of these other changes that I mentioned, seeking out the opinion and help from a mental health professional can help to prevent what you're experiencing from continuing to escalate and impact more areas of your life. If you are already experiencing many of these symptoms, and particularly if you're experiencing thoughts of ending your life, I encourage you to please reach out for support as soon as possible.
Yeah. So it sounds like the level of function, like how well you're doing. Like it's not just having a sad day, it's over and over and over and like getting worse and worse.
Absolutely.
Yeah.
And it may be feelings of sadness. It could even be feelings of numbness.
Yeah.
Not feeling anything at all.
Yeah.
And then definitely if it's lasting for longer than a week or two, and it really starting to impact your functioning, that's when we really start to look at it. This is depression rather than I'm just having a bad day or something hard I'm going through. And those are okay to get support for that as well. But definitely if you're starting to not be able to go to class, not getting your homework done, not going to work, not hanging out with your friends, like those are things that, support can help you get back on track with.
So what causes depression? Can there be multiple causes of it?
Yeah, that's a great question. There's no one cause of depression. There are some risk factors for developing depression. So some of those are just if you naturally have sort of a negative temperament or disposition, if you experience adverse childhood experiences. So those are things like maybe your family went through a divorce or there was substance abuse in your family. If you have a family member who has a history of depression, there's a genetic component to that as well. And depression can really appear at any age, but the age time frame that has the highest likelihood for onset is really during puberty through your 20s.
So we're looking at the college students.
Absolutely.
Yeah.
This is the period of life where it's most likely to first emerge for the first time.
Yeah. Yeah. For me, like struggling with depression, definitely in middle school was rough, but that was seasonal affective. I was in a school that had no windows, people. And then like when I got into college, I started feeling it again, and it was just like, yeah. So are there different types of depression? Like I just mentioned seasonal affective, like the differences, like what types of depression are there? I'm going to get that.
Yes, that's a tongue teaser. There are many different types of depression. They do basically look the same, where you sort of have the same symptoms. The differences really are in either how long the symptoms are occurring for or sort of the circumstances around the onset of the symptoms. So seasonal affective disorder has to do with the seasons and when we're not having that vitamin D and the exposure to the sun. What I have been primarily talking about is something that we call major depressive disorder. So that's when someone's been experiencing those symptoms, at least 5 of them, for at least 2 weeks. A couple of other types of depression are something called persistent depressive disorder. It used to be called dysthymia. And as the name sort of implies, this is when there's a prolonged experience of depressive symptoms, so for at least 2 years. And then there are a couple other types of depression that are more related to hormones, typically related to women. So premenstrual dysphoric disorder typically occurs in tandem with a women's menstrual cycle, and then postpartum depression occurs in the period of time after a person gives birth. So again, the symptoms are the same. It's just sort of how long they're occurring for and what the symptoms were to when they arise.
Makes sense.
So how are college students most likely to experience depression, and what does that look like on them?
So as I mentioned before, early adulthood is really that period of life where someone first experiences depression. But depression in college students is going to look the same as depression in anyone else.
Okay.
But it might be a little bit harder to notice. College students tend to stay up late studying, have a lot going on. So some things to be on the lookout for are changes in your motivation for school, maybe your interest in schoolwork. You start to lose that interest. Noticing that you're spending less time with your friends, sort of withdrawing and being by yourself more often. If you have a loss of interest in activities that you used to enjoy. And again, any changes in your sleep habits. Maybe you feel tired regardless of how much sleep you get. Maybe you're finding yourself forgetting to eat and not being hungry all day. So again, while sadness is the typical mood associated with depression, there are other moods that might be associated with depression too, like feeling irritable or numb and not feeling anything at all. And then a final factor to be aware of is an increase in substance use. So someone might be using a substance to cope with a mental health issue, but also substance use can cause increased feelings of depression. So sometimes it's a chicken and the egg kind of situation, but definitely another risk factor to be on the lookout for.
Is change something that you feel like triggers depression in college students? I know sometimes when you come into college and you get on your own, maybe you can start feeling down. That happened to me. Or even when you're about to leave college and you don't necessarily know what you want to do or where you want to go. Could that be a trigger?
Absolutely. So any type of stressor like that, change is hard for most people. And those transitions of coming to college, being away from your family for the first time can definitely be very difficult. Impending graduation is something that most people are really excited and looking forward to, but is also very stressful. So absolutely, those stressors, although they are fun and exciting things in life, they can also potentially cause a change in your mood and possibly some depression.
So why do you think more women than men have depression?
So no one reason has been determined for this finding that women experience higher rates of depression than men. But one factor that likely contributes to this is the hormonal differences between men and women. So as you mentioned, you hit puberty in middle school. That's actually probably a little bit sooner than most of the boys that you were going to school with. And then as women, we go through more hormonal changes across our lifespan that are also associated with depressive symptoms. So just by sort of the nature of the disorder, cisgender men are not going to experience things like premenstrual dysphoric disorder or postpartum depression. But there are also some societal factors that may impact the higher rates of depression in women. So women are more likely to live in poverty. Women often carry the responsibility of both working outside the home and caring for household responsibilities such as childcare. And women are more likely to experience sexual or physical abuse. So all of these stressors, again, increase the risk of depression. On the other hand, though, there is also some evidence that men are underdiagnosed with depression. So men may be exhibiting depression in less typical ways, such as irritability, anger, physical complaints, and sleep issues. Additionally, men may have a harder time seeking out help because of the stigma associated with mental health treatment, and they may also be more likely to turn to substance use or to try to tough it out, so to speak. So there is evidence that women have higher rates of depression, but I also don't know how truly accurate that is.
Yeah, I've wondered that because that's what's reported. But if men aren't reporting that they're experiencing depression because of the stigmas that are in place, then is it really?
Exactly.
Yeah.
Exactly. And again, they may be also not realizing they're experiencing depression because they're not feeling sad and tearful. They're angry and not feeling like they can go to work or taking it out on their family and causing fights.
Yeah, absolutely. And you also mentioned the stressors. We did a PAWSCAST on stress, so please feel free to check that out when you have some time.
So do you think that patriarchy is maybe a big reason why men experience depression, the pressures of being a man and those kind of things?
Yeah, I think that, I don't know exactly what the research says about that, but I would certainly say that anecdotally, I think that that's certainly a factor there in either why men express depression differently or experience depression differently, and also their hesitancy in getting support because of the stigma against talking about feelings.
Right. So what are some treatments that you can seek for depression?
So typically a combination of therapy and medication is often the most successful treatment for depression. And when you meet with a mental health provider, they'll be able to assess the level of treatment that's most appropriate for you and address any concerns or questions that you might have about that treatment.
And how can we encourage someone to seek treatment for depression?
So getting help for a loved one can be really difficult. If you're concerned that a loved one is considering harming themselves, you can certainly call 911 or take them to the emergency room for support. But if they're not open to treatment, all that you can really do is continue to tell them that you're concerned for them, that you think that they would benefit from treatment, and you can offer to help them with that process. But it really is up to them to take that step of getting help, which can be difficult.
Yeah, that's a real struggle for the people around who are looking at their loved one struggling. That's really rough.
Absolutely.
Probably because it's not, like you said, for men, it's not normalized to get treatment. For a lot of people, different minorities, it's not normalized to get treatment. So how can we help to normalize to get treatment for depression?
So I think the way we normalize seeking help for depression is by talking about it, right? By being cognizant of the way we talk about mental health issues, both to other people, but also to ourselves. I think a lot of people minimize the challenges that they're having. And when we do this, it not only stops us from potentially getting the help that we need, but also sends the message to others that they shouldn't need support for their own issues. And on the other hand, if we are getting support, sharing that experience with others may be the encouragement that someone else really needs to get support from themselves.
Yeah, because depression is rather prevalent. A lot of people experience depression throughout their lifetime. So normalizing it, so what type of resources are available for people out in the community struggling with depression?
So in the community, I think the best way to kind of figure out what resources are available to you is really just getting on that handy Google and doing some research to see what's available. Depending on your financial resources, it might be important to check with your health insurance to see who is covered by your health insurance and what types of services are covered. But there are also often community mental health services that will see people on a sliding scale basis based on their financial need and without needing to go through insurance. There are also lots of resources on the internet these days, and while you do want to, make sure it's a reputable resource, there's a huge amount of telehealth therapy available now. So if you're in an area where there aren't a lot of mental health professionals, telehealth might be a way that you may be able to get some support now.
So what are some resources for our campus in particular for students or faculty?
So for students, excuse me. So for students, CAPS is a wonderful resource that's available to students. We offer both individual counseling, group counseling, and also crisis services. If you're ever interested in those services, all you have to do is give us a call. Our number is 301-687-4224, and we'd be happy to set up an appointment for you to meet with someone. And we also both offer in-person and telehealth counseling right now. We also have lots of self-help resources on our website. So if you're not quite ready to take that step of talking to someone, want to get some more information first, those self-help resources are also available to you.
And we also, through the FSU SAFE office, we also provide resources through educational programming, peer mentoring, and you can always just come in and have a sit down and talk with any of us. We would love to see you guys. Thank you so much for watching our PAWSCAST with Dr. Mandell, and we hope you appreciated it. See you later.
Thank you for being a part of our PAWSCAST. This Health and Wellness podcast is brought to you by the Prevention Center and the Peer Education Network at Frostburg State University. If you would like more information about our programs, visit us in Pullen Hall 109 or call us at 301-687-4761. Or you could also send us an email at safeoffice@frostburg.edu.